This lecture will cover the non-Enterobacteriaceae gram-negative bacilli, gram-negative rods, that do grow on MacConkey agar. With our gram-negative bacilli that are non-Enterobacteriaceae, Plesiomonas was covered in the Enterobacteriaceae lecture, but it is oxidase positive, and so that does kind of stand it out from the Enterobacteriaceae. So what we're looking for is gram-negative rods. Of course, these do grow on MacConkey, and then if you were to do an oxidase test to try to figure out if you're dealing with an Enterobacteriaceae or a non-Enterobacteriaceae, then that would kind of narrow it down to your Areomonas, Pseudomonas, Vibrio, and of course your Plesiomonas is an Enterobacteriaceae, but it would be the oxidase positive. So going back to our flowchart, we've already covered most of these organisms, but remember we start off with looking for growth on MacConkey agar and then determining if it is a lactose fermenter or a non-lactose fermenter. And so remember with our lactose fermenters that we do have a few that can sometimes present as a lactose fermenter. So this would be your Vibrio or your Areomonas. And so even though they can sometimes present as a lactose fermenter, we're going to work them up in the non-Enterobacteriaceae workup. So with our, which that brings us over here to this side. So with our non-lactose fermenters, we've already covered the ones that were oxidase negative. So if they're oxidase positive, then from there we're going to do some different testing to help figure out which organisms we're dealing with. So if it is, next we would do a glucose oxidation fermentation test. And so if our organism oxidases glucose instead of fermenting it, then it would be a Pseudomonas. The Pseudomonas also has some distinctive characteristics that helps kind of differentiate it without having to do this glucose oxidation test. But then if it ferments, then we've got other tests that we will do to determine, or if we determine it's not a Pseudomonas, then there are some other tests that can be done to work these organisms up. And again, if you were in a large hospital lab, a lot of these tests would be done automated. However, if we were in a student type setting or physician's office setting, then some of these tests would be done to work up these organisms. So again, we are looking at our organisms that are oxidase positive. So we've determined if it's a glucose non-fermenter or glucose fermenter. So a Pseudomonas will actually oxidize glucose, not ferment it. Our Pseudomonas also has a lot of distinctive characteristics like the metallic sheen that it presents on the agar plate, as well as it does have a grape-like type odor. And there are other Pseudomonas species that are encountered within the clinical setting, but the most often encountered is the Pseudomonas aeruginosa. And so in order to differentiate between the Pseudomonas aeruginosa and other types of Pseudomonas species, automation would be used to do that testing. So with our glucose fermenters, we have narrowed it down to Vibrio, Areomonas, and Plesiomonas. And so again, Plesiomonas we have covered in the last unit, in the last lecture for the Enterobacteriaceae, but those are DNase negative and string test negative. So our first test that we would want to do would be a string test, which would confirm our Vibrio, because our Vibrio is string test positive. And then of course our Areomonas is a string test negative. So we have our positive and then our two negatives. And then these negatives would be differentiated based on the DNase. Pseudomonas is found throughout the environment. It's pretty much can be found anywhere within any sort of community environment or hospital environment. And so because it can be found in a lot of places, it's just an average contaminant, then it's very easy to get a hospital-acquired type of infection from this organism, as well as a community-acquired infection. It is transmitted to the host via ingestion or through some sort of exposure of contaminated food, water, or a medical device. And there are several virulence factors associated, for example, exotoxin A. And one that's very notable is that it can produce a biofilm that is related to the alginate. And so with this, what will happen is it will actually have an overproduction of this, and then it will produce a biofilm that gives it a mucoid type of presentation. And so this is commonly what is isolated from cystofibrosis patients, that it will end up actually infecting the lungs. You know, they already have problems with clearing that fluid within that lungs, and so the Pseudomonas will actually create that biofilm, which makes it a little bit harder to treat. So what you see actually on the previous slide as well is that the Pseudomonas can actually infect different areas of the body. And so because a Pseudomonas has some very distinct characteristics, then it can cause a green type color. So you saw the nail in that last picture that had that green type color, and then you can see the infection of this eye, as well as some of the urine. Now, just because the urine is green does not mean that it is a Pseudomonas infection. Just know that it can, because it produces a pigment, that it can cause some of these infections to present with a little bit of a greenish shade to it. And so there are a variety of infections that it can cause, and like you saw with that nail infection on the previous slide, this is why a lot of hospitals say that staff must keep their nails trimmed really short, as well as they prohibit the use of artificial nails, because the Pseudomonas can live under those nails, and especially if you're working in the nursery with infants or doing any sort of wound care, then you can potentially present that bacteria to that patient, which could cause a hospital-acquired type of infection, not only from just various equipment being contaminated, but just through passing that organism from the nails itself. So occasionally bacteremia can be caused by a Pseudomonas infection, and with this it can actually progress and invade the blood vessels pretty quickly, and then it can from there go into the subcutaneous type tissue. And with this, there's an enzyme that will actually destroy the walls of the blood vessels, and will cause it to kind of start to be necrotic, and then those skin lesions will get necrotic, and then this will resemble gangrene. So this is a type of gangrene that is caused by a Pseudomonas aeruginosa. The gram stain of Pseudomonas aeruginosa will appear as medium-sized straight rods. These organisms will actually grow at 42 degrees Celsius. With your blood agar, these organisms will present as a flat spreading type colony, so you can see where these organisms kind of appear flat. They also have a very distinctive metallic sheen to them. If you remember back in one of the first few lectures where I actually showed what growth looks like on culture media, I believe there's a video in there where this particular organism is rotated on the plate, and you can actually see that reflective metallic sheen. One thing that's very notable, when you remove the plate, remove the top off the plate to look at these organisms, they do have a grape-like odor to them, so it's very distinctive. It kind of helps you identify it. They are non-lactose fermenters on the MacConkey agar. And sometimes you can have those mucoid species, especially that's seen with cystic fibrosis patients. This organism, the Pseudomonas aeruginosa, it will actually produce a diffusible pigment that will diffuse down into certain augers. And so with that, it gives like a blue type color. And so that's where you get the cyan here. And then that can actually combine with the pyroviridin type pigment, which gives it a green type color. And so that's why some of these species, if it's plated on the proper agar, then it will actually appear as a green type color. And sometimes you can see it a little bit on the blood agar if it does have a little bit of that pigment to it. For your biochemical tests, they are oxidase and catalase positive. It will dehydrolyze the arginine, and it will oxidize glucose and xylose. If this was on a TSI agar, no gas, no H2S, and you would have an alkaline slant and an alkaline butt. So this organism wouldn't have color change throughout that agar. Your Vibrio species are associated with brackish water or salt water. And of course, you would get this through exposure of ingesting that water, or through exposure through seafood, especially if it was undercooked seafood. So these organisms present with a gram-negative curved or comma-shaped type of gram stain. And so you can see a few of these organisms that are kind of rounded here. This is a good example here where it's kind of got a little bit of a curved shape to it, or a comma type shape. And this looks like this was probably a culture done off of a blood culture bottle, or a gram stain performed on a blood culture bottle. So the morphology would be a medium to large opaque iridescent type of organism or colony. And so you can see down here at the bottom where they kind of have that opaque look. And so sometimes, like something that's opaque, when you kind of tilt it, you can kind of see a little bit of the colors in it, almost like an opal. So it might have a greenish type hue to it. They can be lactose or non-lactose fermenters. They are motile. They do have a single flagellum. Oxidase positive, and they do ferment glucose. With your Vibrio infections, there are a couple of different types of species that have been implemented in different types of infections. So for example, ear infections, wound infections, gastroenteritis, and then you can also have Vibrio parahemolyticus, which causes an gastrointestinal type infection through consumption of seafood. So you can see a picture here of that seafood. And of course this would be a type of a skin infection here. Vibrio cholera, this does produce cholera, which would be a profuse watery diarrhea that can cause dehydration. This is also known as rice water stools, and it can also cause hypotension. This is a non-epidemic diarrhea and extraintestinal infection that has been associated with a particular strand of this Vibrio. And there are 3 major groups, and they're all kind of divided out. They have different labels to them, but there are some different types of strands of the Vibrio cholera. And so what they do is they produce a cholera type toxin, and so it causes those mucosal cells within the GI tract to hypersecrete water, and that's where you get that watery diarrhea, or that rice water diarrhea. And of course they have different enterotoxins that are associated with these different strands. Aeromonas are inhabitants of aquatic environments throughout the world. And of course these too can be ingested through contaminated food or exposure to contaminated water and soil. And then they can also be introduced through some sort of traumatic event, like exposure from a fish fin or hooks. And so with these infections, they do present with a gastroenteritis type infection due to the various toxins that it produces. And of course, it too can cause the hemolytic uremia syndrome and kidney disease. So they can be identified based on several characteristics. With these organisms on the gram stain, they do appear as straight rods with curved ends. So you can see here where these gram-negative organisms look a little bit more rounded or plumped on the ends. And so that's kind of characteristic of this particular organism. Their morphology would appear as large, round, raised, opaque colonies on blood agar. They can be lactose or non-lactose fermenters. Oxidase positive, they ferment glucose, and again they are also motile.